The primary purpose of Uniquely Human, the podcast, is to educate and inform. The views expressed during all episodes are solely those of the individuals involved and do not constitute educational or medical advice. Listeners should consult with professionals familiar with each individual or family for specific guidance.
Uniquely Human, the podcast, is produced by Elevated Studio. Music is graciously provided by Matt Savage of Savage Records.
Hi, I'm Dr. Barry Prezant, clinical scholar, researcher, and consultant on autism and neurodiversity, and a Brooklyn boy raised in the big city.
And I'm Dave. I'm none of those things, and I grew up on a farm in Illinois. But being on the spectrum myself, I have plenty of personal insight to lend.
And this is Uniquely Human, the podcast, a show that illuminates and celebrates autism and neurodiversity. Today, we are so pleased to have Dr. Taylor Day on with us. I've corresponded with Taylor a bit back and forth over the last few years, but we finally had a chance to meet at a conference in Charlotte, North Carolina, and we had a delightful but brief conversation, which has led to saying, okay, we have to have Taylor on the podcast. So Taylor, welcome to Uniquely Human, the podcast.
Thank you so much for having me. I'm so excited to be here and to be able to have this conversation today.
That's great. So a little bit about you. Taylor is a licensed psychologist specializing in neuro-affirming care for autistic children and their families, including very early diagnosis and early intervention. She has a PhD in clinical psychology and is the CEO and founder of Dr. Tay Concierge Clinical Care. Her practice integrates the whole family approach, a process she created utilizing evidence-informed principles after seeing a gap in autism care. Oh boy, is that a huge gap. Her passion for child psychology and her focus on autism is in many ways tied to her own personal experience, growing up with a brother who was diagnosed at 23 months of age. So Taylor, there's so much we could talk about. Why don't we start digging in? First of all, a term that has become kind of not mainstream yet, but used quite a bit is neuro-affirming or neurodivergent affirming care. And since that's a hallmark of what you do, would you like to describe that for us?
Yeah, absolutely. I mean, I know you guys talk about this concept of neurodiversity on the podcast quite a lot, but it really is thinking about when we are providing supports. I first and foremost think about how do we see the person in front of us as a human first, as not something that needs to be fixed or changed, or that is made to look more neurotypical. I think in the autism field, traditionally, what we've seen is there has been a lot of that, like, oh, well, we need to get rid of this behavior because it doesn't fit our schema of, what the neurotypical world is. With neuro-affirming care, though, what we're really focused on is uniquely understanding that person. What are their strengths? What are their support needs? How can we provide accommodations? And how can we focus on promoting quality of life? So we're not working on skills just because the neurotypical world says, well, this person should be able to look you in the eye, but rather asking ourselves, does this actually improve quality of life for the autistic individual? And do they want to work on it? That is a really huge part of all of this.
And when we have that little kind of prefix of neuro, it gets right down to the fact that we have to embrace neurological differences that leads to some of what you're talking about. Maybe behaviors that look different, aren't quite conventional, don't fit social quote unquote norms, whatever those are. Such an important issue. Absolutely. And you combine that, which is, something I feel so deeply about, is the whole family approach, in your words. So talk about that a bit as well.
Yeah, I mean, I think what we see in the autism field is that care, I work with children primarily, but care usually focuses on the autistic child. But what we know when we take a step outside of the autism field is looking at the family system is really impactful. What one person does in the family impacts another. And so it really is about supporting the whole family through this journey. And one of the things that I got to live firsthand when my brother was diagnosed, there was no support for my parents, which in turn that meant no support for me as a sibling in this journey. And so it really is making sure that we're helping the whole family understand everyone's brain wiring, because that's the thing we also know. If you have one autistic person, the likelihood that there's another neurodivergent person in the family is significantly increased. But also, even if that's not the case, everyone has their own strengths and support needs. And so how can we look at each of these pieces and each family member and how it's affecting the other people?
Yeah. And we were saying before, it is so heartbreaking when you see parents who are, of course, younger, because that's when most parents are having babies is when they're, younger, earlier in life, barely equipped to handle the unique demands of any child, right? And then you factor in multiple children, and then they're just getting good at raising one child. A sibling comes along, and now they have to make very hard choices in terms of, I'm so sorry, once again, we had to suspend the fun thing we were going to do today, or reschedule it, or whatever.
Yeah.
Absolutely.
I mean, it's so overwhelmingly confusing for so many parents, especially if it's a first child, and just seeing the individual differences across all children. But as you know, Taylor, so often parents say, even as a child's developing, what's the autism? What's typical child behavior? How do I navigate through this? And how do I be developmentally appropriate, especially if it's parents who are first learning about the developing child and child development?
Right. And then we add on the layer of, when you first get that autism diagnosis, we have to remember parents are humans too, right? And so then they have their complex emotions that come up. And that is so normal and valid in this process. And I think many diagnosing providers don't forewarn parents about the emotions that they may need to process through.
Mm-hmm.
So a lot of times then I see a lot of shame and guilt too, of trying to navigate through all of this and oh, I shouldn't be feeling this way. But the thing is, you can have these emotions and still love and accept your child unconditionally. And so I think helping parents actually navigate, how do you process your emotions? How do you sit with them? How do you help your non-autistic children also do the same? How do we hold space for these emotions? I think becomes such an important piece of this. And one little note that I often say to the families I'm working with autistic children, historically in the research literature, we've heard quote unquote, they don't have empathy. We know that that is not true. It just looks different. But what I find for a lot of these autistic children too, is that they're super sensors. They notice the energy. They notice this emotion. They might not always have the communication to be able to express that. But that's a great example when parents aren't processing through their own emotions, it's getting suppressed down, but then that affects the overall energy and the feelings that are kind of in the family that everyone's processing through. And I find that autistic children are often hyper attuned to that.
Absolutely. And I don't want to get us too down into one kind of rabbit hole or another, but I will say this too is, the kids being super sensors. I appreciate you sharing that, because I've always been in tune to what's going on and absorbing it like a sponge for the most part. But what it doesn't do is transfer into me the emotion of what's going on, I guess. And that's maybe the difference between empathy, the way people typically think about it, and then other empathy, however you want to categorize it. But I kind of liken it to, here's a sibling in developmental years absorbing everything like a sponge. And it's one thing if you're just on the tram at the airport and somebody's in a foul mood and they kind of bicker at somebody else, and then you see it for a second and then you immediately step off the tram because now you're at your terminal. And it happened in the past, and it was like a fleeting moment of like, oh, a little bit of worked up. But when it's a cumulative effect day in, day out in the place where it's supposed to be, your home, your safe space, your place to recharge, and you still don't feel 100% settled or safe, that has got, I'm not an expert, but that has got to build just an increasing baseline of whether it's anxiety or stress response or something.
For sure. I think, that cumulative effect. And I know we want to dive into PDA at some, but we're going to talk about this cumulative effect that happens, for these kids and on their nervous system, what happens.
Bingo.
Oh, yep. All right. Well, we're diving in. And so I really hope that we can have a discussion about this, because it is something that has gotten a lot of attention over the last few years. Some people, kind of put a little tag on, well, kind of a controversial label. But certainly many adults on the spectrum are acknowledging a profile that really helps to explain their experience. So teach us about PDA, what I call the pathologizing term and the neuro-affirming approach to discussing it, because you have done a lot of work in this area. Go ahead.
Yeah. So PDA stands for Pathological Demand Avoidance, was the initial definition. And a lot of the autistic community doesn't like that because it has a very stigmatizing, description to it. I mean, pathological says that something is wrong as a result just by the word. And so what we've seen is a lot of the autistic community talk about their preference for either persistent or pervasive drive for autonomy. Ultimately, what PDA is one, I want to give this caveat and this disclaimer. We're still learning about it because there is very, very little research. And this is where I see where the concept of neurodiversity hasn't caught up to the research world. And Barry, I know you and I, when we met briefly, we were talking about that, like how slow it is to kind of get rolled in. So it hasn't really been studied. And so right now it's a theorized profile. But what I will say, working in this space clinically, is for me, family after family is saying oh my gosh, this finally makes sense. It's something that helps me understand my child. It's something that allows me to, go on the right path for supporting my child. And then individuals, who are autistic are also saying no, I experienced this. And this is where, as clinicians, choosing to believe the lived experience becomes so important, even if we don't have the research to back it up. But put simply, what PDA is it is nervous system activation or dysregulation, but it's this cumulative effect where it's not one thing that triggers the nervous system, but it's like a hypervigilance of the nervous system. So where the body goes into what we traditionally call fight flight mode of kind of that panic, arousal, the hypervigilance, all of that. But we also can see freeze fawn with it as well. And that, and that's the whole thing, is it can present very differently, but it is this nervous system disability that ultimately creates a lot of dysregulation and feeling not safe for the autistic individual, and not safe psychologically, emotionally, not actually physically.
So what do you actually see in kids that begin to check off boxes that you're saying, well, maybe we're seeing a PDA profile now? What do parents come to you with? Then you begin to, as a clinician, as a evidence-informed clinician, you begin to say, okay, this profile is beginning to make sense to me because this is what I'm hearing.
Yeah, I mean, I get a lot of referrals for parents who interestingly learn about PDA from social media. Their child's never been diagnosed with autism. A
Mhm.
lot of times they've actually gone through autism evaluations and have been told, no, this isn't autism. But, ultimately what presents first is some of these like more behavioral challenges or anxiety challenges. So what this can look like, I get a lot of parents that say like, I feel like I'm always walking on eggshells. Like I never know kind of when my child's going to become dysregulated, giving simple demands or tasks. My child like goes into kind of like a full blown like panic mode or won't comply with what those requests are. A lot of times these are also parents that have gone through more traditional approaches with behavioral therapy, and they find that it actually makes things worse rather
Mhm.
than better. And I think one of the really sad things about this that I will say I hear time and time again is how parents that are raising these kids are being told that it's their problem. Because a
Mhm.
lot of times what happens, not for all with this profile, but at school they look like the ideal kid who's being really compliant, but then they're coming home and they're melting down every single day for extended periods. And so sometimes schools will be like, we don't see it here, it must be you. Or they'll work with therapists on more behavioral approaches, and it's like, oh well, you must not be doing this right, like this works. But it doesn't,
Mhm.
because what it's doing is it's further activating the nervous system, because all of these therapeutic approaches are demands on the nervous system,
Mhm.
and they don't feel safe and they don't feel seen and heard. And so it's this cascading effect that happens.
Absolutely. And this is where it becomes fascinating because, uh, well, first of all, blaming the parents. I can see firsthand, I know that my work day is, sometimes 15, 16. Well, so now that I'm back in corporate America, it's usually 15 plus hours a day.
Oh,
And at the end of it, I've been it's especially it's a sales role. So I've been like that student you're describing, just keeping it together, big game face on. And as soon as the workday is over, is like if I have one more person ask me for anything, I'm just I'm gonna get in my car and drive to the desert, and nobody will hear from me again. Uh, so not only that, but with my own kids, when they would come home from school to a lesser extent now that they're in their late teens and graduating high school, but certainly middle school, elementary school, early high school, it was let them come home, don't ask them for anything,
yeah.
because they're both very very intelligent, very very quirky, and they get that from their mother. I'm just kidding. So the we just knew that they were not they didn't have whatever resources a person can marshal to continue quote unquote masking once they got home. So give them space to just be what they need to be for a couple hours, and then start
Mhm.
talking to them about like, how was everything today? How did you do? It's so noticeable. And I can't believe that this only affects neurodivergent children, but let's just focus on the neurodivergent
Well,
children. Yeah.
and Dave, I want to follow up just on that point. It was right on my tongue. And so this is of course, a question for Taylor. Um, what kind of people who defend this as a real distinct kind of clinical profile say, wait a second, kids push back all the time, or kids need their space all the time. Kids don't like having demands being imposed upon them often. But here, the sensitivity and the triggers sometimes seem to be, but why is she melting down with that simple little request? That's not a big deal. At least from the neurotypical perspective, it's not seen as a big deal. So if you could speak to that, because, my understanding of, and I'll use the term PDA, uh, is that the sensitivity is so extreme in so many cases that especially parents just throw their hands up and say, I don't know what to do. And this professional tells me more discipline, and somebody else says ignore it. And and obviously we're going to get to some, expertise that you could share about ways to support kids.
Yeah.
But what about that distinction? Well, it's just an anxiety response. Everybody has anxiety responses versus, no, this is different.
Yeah. I mean, I think that there's a gradient for everything. And there's a point, though, where it really starts impacting daily functioning.
Mm-hmm.
And, I mean, it's kind of, in some ways, it reminds me of this concept of people being like, oh, well, everyone's a little autistic, which always like irks me so much.
Yes.
Like, no, like, that's not how this works. Yes, it's a spectrum, but at the same point, like, for it to be a diagnosable condition, which, as a quick aside, PDA is not, but autism, it all falls under the autism umbrella. You have to have this impact on daily functioning. And I think what the difference is how like profound this is, how intense it is, how long it's lasting, how frequently it's happening.
Mm-hmm.
It becomes this pattern that really is interfering with the child being able, or the adult. I say child a lot because I'm a child psychologist, but the individual being able to access what they need to. And what's really fascinating about this, so talking a little bit about that freeze fawn response,
Mm-hmm.
is a lot of times for these high maskers, and PDA is not always associated with high masking autism. And I think that's what we hear about on social media a lot, but I want to be careful not to make it sound like they're synonymous. But for those that, have this theorized PDA profile and are high masking, what can happen at school is that freeze fawn response. So freezing, where it's just kind of not doing much at all. The fawn is like that people pleasing kind of quality or trait, and trying so hard to comply. And to Dave's point too, what I like to think about it is it's a bucket, and that bucket is filling throughout the day. And by the time it gets home, you get home, it's overflowing. Also, by the time this child gets home, they're realizing that they're in their safe environment to unmask, to be themselves completely. And so a lot of times we go from this freeze fawn response to this fight, flight response at home. But what I want to emphasize, and I think this is sometimes hard for schools to see, and I actually I have a podcast as well, and I had some guests come on and talk more about the school setting. But when someone's in this freeze fawn state, they're not effectively learning, because we know that individuals have to be both regulated and engaged in order to learn. Well, they're not effectively regulated. And so that's also a great example of where it might not be outwardly presenting, but it's still impacting the individual. And so I think what our differentiation, to sum this up, is how much is it impacting? And that tells us that greater supports are needed in order for this individual to be able to access the world in the way that they deserve.
And I think it's so important that you made the point earlier about, it's basically a neurological triggered response.
Right.
We'd like to take a moment to thank you for listening to Uniquely Human, the podcast. It is so gratifying to hear that so many of you find value in what we share.
It is gratifying, and it's so much fun making this show together, Barry. Being able to meet with you every week and all the guests and listener support that we've received, it's such a joy to make this show. And of course, we are commercial free, but Barry and I would invite you to support this show in a number of different ways. That could be buying our books, or even inviting us to speak live or virtually to your organization or to your community. To learn more about all of this, you can, of course, go to our websites, barrypresent.com or davidjfinch.com, to learn more about our speaking topics and how to work with us and all of the consultative services that we provide.
And we also want to know how we're doing. We are in a constant quality improvement mode here.
Yes.
So please make sure to leave comments and ratings, suggestions on social media. Contact us directly on the links on our website, and recommend Uniquely Human, the podcast, to those in your lives. In conclusion, we are so grateful to you, our Uniquely Human community, for your support and loyalty, and we'll be keeping at it.
Yes, thank you all so much. Now back to the show.
we had mentioned just before we came on that both of us have learned from Dr. Bessel van der Kolk's book and his work. And I had the chance to meet him last week at the Cape Cod Institute, one of the all-time leaders and not uncontroversial in terms of research on not autism at all, actually, but research on trauma. When I spoke to him, he said, well, what are you presenting on this week? And I told him, and he said, I know nothing about autism. Yet everything I'm sure that you've read and that I've read helps to explain what we're talking about here, these almost subcortical protective reactions that, of course, he talks about the connection to various degrees of trauma in a person's life, and how that may be triggered. So do you think about that, the relationship, since it's such an important issue in the autism community now, the relationship between PDA and trauma?
Yeah. I mean, I think, to be candid with you, I think to do like neurodiversity affirming care, you also have to do trauma informed care as well. Because what we know for autistic individuals, they're living in a world that doesn't feel safe to them because they're not accepted. They're told to be different. They're constantly getting feedback. And for someone to really be their authentic self, they have to feel safe. In order for someone to be regulated and engaged, they have to feel safe. And I think these people have a hard time with this. It's like, well, I'm a safe person. Like, I can do that. But it's like, we don't get to determine ourselves when we're working with autistic individuals if we're safe or not for them. They're going to determine that. And I also think that it doesn't mean you're an unsafe person, but sometimes they're operating in an unsafe environment. School can be that a lot. There's a lot of demands. Sometimes, I work literally across the country with my practice. So I get the opportunity to see a lot of different IEPs. And there's some schools that like absolutely kill it in the best way possible and are learning about neurodiversity. And there's some schools that are just like, no, like super rigid. And it's like, you can't do that. Sit still. I need you to, work on eye contact. Like that doesn't feel safe to an individual. And so I think absolutely when we think about this trauma piece, it is tied to the safety piece, and we need to be thinking about it. I think it's also important, though, to note that the more critical advocates of PDA, meaning they question like, hey, is this real? And this is a huge conversation going on social media right now. What they really want is more research, but what they also say is, well, is it these co-occurring conditions with autism that we're seeing too? Is it a trauma response? Is it anxiety? Is it ADHD? And is it that all, OCD, depression, all of these needs are unmet? And that's where then we're conceptualizing it as PDA. And I kind of view it in this lens of being a clinician of it doesn't need to be either or. So when I'm quote unquote diagnosing PDA, again, it's not in the DSM, it's not a diagnosable condition. I am, ultimately saying autism. At this point, I always have diagnosed a co-occurring anxiety disorder with it, because it really does fit this lens of an anxiety framework of this, nervous system activation, this fight flight response, goes hand in hand with anxiety, which then also can be linked to trauma. And then we can also see these cascading effects of depression, for example, coming in when there's autistic burnout in particular, which a lot of the kiddos that I work with have this like autistic burnout pattern because they've been navigating and they're this world again that feels unsafe and their bucket is so chronically full all the time.
Yeah. And speaking on behalf of literally every autistic human on earth. No, I'm just kidding. But speaking for myself, and I think for a lot of people, there's also, whether we're consciously aware of it or not, there's also the factor that I know for me personally, when I see something happen one way and it flags for me like that it's a significant thing that happened, whether it was like an unpleasant result or like some bad news was broken, whatever, I assume that that thing is always going to happen that way. So like, a dog nipped me on my heel when I was, 5 years old. And now that I'm 18, I still think that every dog I see is, because that's what dogs do, is they nip me on the heel. So you're building these mental models that, in my case, and I think in a lot of cases for a lot of individuals, it becomes a very rigid model that you don't end up questioning, breaking down, and reforming. It's just, no, that's my model. So then when you walk into the classroom, all right, I'm the pariah. I'm the kid who's going to do everything wrong today. And I would defy anybody to walk into a classroom setting or a professional like work setting where they work to always feel like they're the one who's going to get it wrong that day, and then still show up with a great attitude and say, okay, let's work on this together. It doesn't work like that.
Yeah.
And it doesn't matter what your age is.
Yeah, absolutely.
That self-awareness piece that you're kind of demonstrating right now, Dave, is huge. And I know that's I don't want to overly cite Bethel's work, but I mean that's what basically he says, that to deal with trauma, one of the best things, and of course we all know this, and I think it needs to be said more and more, that helping a person be aware of what are the triggers, what's the history here, bringing it to a conscious level rather than being a victim of, okay, fight, flight, freeze, neurological system response. Being able to have that sense of what's going on and what I could do about it. So Tara, let's talk about what we could do about it. Let's talk about the ways to support people. And I like the word profile, but with PDA profiles, support families. I know, as you said, it's so true. We're still learning. We're learning so much. And I think you said one important point. I just want to make sure we put an asterisk next to it. Therapies that try to control people, especially many behavioral therapies, it flies in the face of, if this is a persistent need for autonomy, it's like, wait a second, you're using an approach that's 180 degrees different than how we have to support a person. So how does that translate into support work and support strategies?
One quick caveat, because, and I won't go on my soapbox about this, but I think it's just real quick interesting to think about that the way kids are raised, we assume and desire compliance for them. And then when they turn 18, we want them to be their own self-advocates. We want them to be able to, have this autonomy. And that's a hard transition for any individual. But then when you think of an autistic individual, a lot of times, kind of actually, Dave, what you were saying of building this mental schema of this is how things are supposed to be, that switch can be really hard. But then I also think about, sometimes for autistic individuals, they just need more trials to kind of learn those skills. And that's the thing, autonomy, agency, self-advocacy, all of these are skills. And so why aren't we teaching this sooner on? And why do we just expect someone to all of a sudden switch at 18? And we're seeing a huge, group of people that are having a really hard time with this, that are now going to therapy to learn how to self-advocate for themselves. So let's start early with that autonomy and that agency and practicing that skill. So I think that's an important piece. It felt important to say, but I also think for parents to reconceptualize this framework of, we live in a world that really prioritizes and values compliance. And some of this work is with parents themselves of, okay, how do you begin to have this mindset shift of things should be this way to actually questioning if that's how they have to be? And so on social media, you'll hear about a lot of like what is called low demand parenting. A friend of mine who is also a therapist, and I steal this all the time, reframed it as high autonomy, high agency parenting. And I really, really love that of like, how can we give that autonomy and that agency? And so real quick, I'll share something I teach parents a lot is I like to think of 3 buckets. I love bucket analogies, clearly. But 3 buckets, we have that first bucket of what I call the non-negotiables. What always goes there is anything related to safety, and then family values that are like of really, really high importance. These are the demands that you're going to give always. They're the non-negotiables. On the other far end, then we have what I call the shoulds. These are the things that ultimately families, and as kids, when we were raised, we learned were important, and then maybe bring into parenting as well, or the world tells us things should look like this, like, oh, you always should sit down at the dinner table as a family. Actually checking in with yourself of like, wait a minute, how much do I really care about that? And there's a lot of times things that we can learn to drop that don't feel that important. And then the middle bucket is what I call the ideals, or I sometimes call it the yet bucket, where it's like, okay, we're not there yet in terms of giving these demands. We'd like to work up to that ideally. I find when kids are in autistic burnout, we're not touching this ideal yet bucket right now. And so what this means as a whole is we're focused on really the demands we're going to give are those non-negotiables. And then we're going to have flexibility and try to give autonomy and agency around the other things when possible.
Just hearing the word demand, I'm just wondering if it would be helpful for parents to kind of hear the word expectations. What expectations do you have for your child? Because some parents will hear demands and it's like, okay, I am the captain of the police force here. And which actually gets to another point with your first bucket. You have quite the bucket list, by the way.
I do have one of those too.
But for the first buckets, things that are non-negotiable, one thing that I have found is, and of course it depends upon the child or the person's level of comprehension and so forth, but explaining why. It's not just that, well, you got to listen to me because I'm dad. Okay. Well, okay, you can't do this because you're not going to be safe, or it could hurt, or something along those lines. And I think that's ignored too much. It's just kind of give the demand, child doesn't do it. Okay. Give it again. If the child doesn't do it, physically prompt them to do it. I mean, but like you said at the very beginning, we're talking about human beings who have the right to be respected, such that we can try in any way to explain why this is important, either not to do or to do this way.
Yeah. Yeah. I mean, I love using the why in the explanation for sure, because what that does, so in parenting, naturally, there's a parent-child hierarchy. And with what we're kind of trying to do with some of these strategies is almost flatten the hierarchy, where the child doesn't feel like the parent's just saying to do things. And explaining, for example, can be one of those great things, or giving choices in this, or I also would really encourage parents to look up declarative language, which I know, is in your realm. A lot of like speech language pathologists talk about this, but that can be really helpful of something. I wonder
if I could just interject.
Yeah, please.
Linda Murphy, who wrote the book on declarative language, number 1 is coming up. Number 2, she was a student of mine.
No way. Yeah. I love her work. So amazing. Awesome. And I'll have to tune in and listen to that episode, because it is really important for sure. But yeah, I think it's something like, I wonder if people might trip over your shoes that are sitting in the middle of the hallway versus this demand, or maybe this expectation. And it's interesting because technically a demand is the outward behavior. The expectation is like the internal thought process that happens. So kids should put their shoes away when they walk in the door, and, they should know how to do this. And the demand is, I need you to put your shoes away. I'm going to trip over them, right? That becomes the demand, versus something like declarative language of, I wonder, that allows them to think about it. That allows them to feel, as if they're making that choice. So it's a perceived sense of autonomy, but we also need to make sure that with that declarative language, as an example, that we don't have this underlying expectation of like, I wonder if you should, maybe move them. And then they're saying move them, right? That doesn't work. We have to, this is where the mindset shift piece comes in for parents as well.
Yeah.
I wonder if you should be playing in heavy traffic as opposed to get off the street, you stupid son.
There's certainly okay, this is what we are doing. Okay. I wonder if we should leave the house if we see smoke coming out of the stove. No,
right.
I'm going to pick you up and we are getting out of here.
Yeah. But I do think that's a really important, I know we're like laughing about this, but a really important point. That's the non-negotiable bucket. That's an example of where we are giving the demands of, this is really dangerous. I cannot allow you to do this. And this is sometimes, I'll be honest, when I hear about low demand parenting on social media, that there's this misconception that it's really permissive parenting. And the thing with it is low demand or high autonomy, high agency parenting takes a lot of forethought, a lot of intention. These are very intentional parents who are doing this. But two, I once was asked by a parent who was in a community talking about PDA, and I had just diagnosed her kid as autistic for the first time with the PDA profile. And she said to me, there's a lot of conversations that it's like, well, if my kid hits me, I just have to let them hit me. Like, that's consistent with low demand. And I'm like, no, that's not consistent with low demand. That's this non-negotiable bucket. What you can do is, I cannot allow you to hit me. That is the demand. Here's what you can do instead. You are allowed to be angry. You can hit this pillow if you want to, or sometimes for some kids, it's, I need to, you're going to be here. I'm going to go over here. We need some space right now, and allowing the kid to come down off that peak emotional intensity before going into the why. I love the why, but the timing of the why is critical. In the middle of the meltdown, why does not usually work because the prefrontal cortex has gone offline at this point. There's no logic and reasoning at that point.
Totally. That's exactly it. And that's something I learned way too late in my parenting tenure, which was like, there's the time for the lesson and there's the time for, breaking a cycle. And those usually aren't concurrent. It's usually, let's just get the situation kind of manageable. And then later we'll, try to make that explanation. So one thing it's so interesting to me, Barry, and I'm kind of interrupting your answer, Dr. Taylor, is that we're talking about this in terms of, so the bucket being filled is a great way to look at this, because when you do have a situation that is requiring or would necessitate a very specific, unapologetic demand, get out of the street, the stove is smoking, we're leaving now, by the time most kids or even young adults and adults have heard that for the umpteenth time that day, they've got this demand exhaustion or fatigue, we'll say. If you can be intentional and approach as many of those interactions throughout the day with some, with a mindset, with an intentional mindset, trying to basically make your way through as many of those situations as possible with that intention. By the time you do get to something that is a strict demand or command, speaking as the individual in this case, I know that when I don't have that fatigue, I'm far more receptive to somebody saying, all right, non-negotiable, this is what we're doing.
Yeah. Thanks for pointing that out, because I think that's exactly it. And it's cool for you to be able to speak on your experience and how that does resonate, because that's the conceptualization. So a lot of times too, when I hear parents saying like, well, how do I stop the aggression? Our brain goes to like what I call reactive support strategies of like, well, how do we directly target the aggression itself? And I like to really slow parents down of like, what can we do proactively to help support the individual to be able to regulate better, to be able to ultimately like, not get to that point, because aggression is a form of communication. They're telling us that they're done at that point, right? And so can we do things to help support them before that even comes up? And I think that is the most powerful tool in your toolkit is, focus on, okay, how do we fill the bucket less over time so that the individual doesn't even get there? Because trust me, that individual doesn't want to be there. Like, I at least with a lot of the kids I work with, there's often a shame spiral that comes after
Yes.
for these episodes. And And that also tells us they don't want to be doing this.
Mm-hmm.
It's this automatic response. And I love Dr. Russ Green's framework too of
Mm-hmm.
can't versus won't. Like in that moment, they can't access regulation strategies. They can't access other forms of communication because their nervous system is just so overwhelmed. And every individual does hit this too. And so sometimes I like to help parents like go back. When's the time you felt really irritable and then your kid spills milk and you're losing it, right? It's not about the milk. Like it's about everything else that came for that throughout the day.
Totally. You know, Barry, I have to say too, this is not a shameless plug. I say this actually to help support our conversation and to help the audience. But Taylor, this is so much in line with what my wife does on a daily. So my wife is a life coach, and she has a podcast that it's called Calm AF, and because the reason she chose this mentality of Calm AF specifically is it's a willful self-regulation practice. It's when you're in those white knuckling moments and you can access certain tools that will give you the regulation strategies that then kind of permeate the situation. And it's funny when you lead, when you're the calmest energy in the room, you can control the room. And I see it all the time when I'm at the grocery store and, little Maxwell is sitting there with his, third opened box of cereal, dumping it on the floor. And the mom is yelling at Maxwell and the dad is yelling at the mom from 3 aisles over. Nobody's really putting in the effort to regulate. Right. Mm-hmm. And everything Kristen touches on with her primarily not autistic client base, and certainly all the listeners on her podcast, it's all the same themes that you're describing. It's what to do when you are in a hyper-vigilant state. Mm-hmm. How do you, A, recognize it? B, do you understand what that's doing to you, the other people around you? How do you then lower the temperature on that? How do you then access your higher self? How do you then regulate better? The fight, flight, fawn, understanding what that does to you situationally and how you can show up or not show up. And it's so interesting to me that, yes, we're talking about this through the lens of neurodivergence and families and siblings and the whole sphere of that. But even outside the world of autism and neurodiversity, Kristen is dealing with this on a daily basis with the people who are quote unquote normal, certified, totally normal, no diagnosis, right? So this is like as Barry always says, understanding the deeper why, because this is a huge shared human experience. This isn't just autistic people.
Exactly. Yes.
Yeah. And it becomes magnified, I think, for autistic individuals in terms of, some of that, the challenges with the regulation and all of that. But and Barry, to go back to your question of how do we support, one of the things that we do know is co-regulation is such a supportive strategy. And what that means is that the parent has to be regulated themselves. It's easy for me to say that. It is hard to do in practice. And a lot of times too, then I'll hear parents be like, well, I don't have time to get myself regulated. Like I'm worried about everything else. This connects back to that whole family approach, that when parents can work on their own regulation, then they can be an available nervous system in these moments for the autistic child to co-regulate with.
I want to share briefly a discussion that we had at our parent retreat a few months ago. We've been doing that as parent retreat weekend for 26 years now. And one parent in the discussion group was giving advice to a parent of a younger child. And they said, well, one thing you're going to learn on your journey is you need to pick your battles. Then another parent said, well, what we've learned is don't view them as battles. Let's really, because if you have that mindset going in, then you put on your war gear and your helmet and you take out your gun. And maybe that's just that shift of that lens. Okay. As you said, a lot easier said than done. But we have to it has to be so hard. And we know it's so hard for the parents that we know, and for all parents, that when you anticipate it's going to blow up in my face and it blows up in your face, meaning that the child gets very, very dysregulated in that circumstance. But just getting away from that notion of this is going to be a fight, okay? But that fear from previous emotional memory is there as well. So that's really hard. Yeah.
Yeah. The us versus the me versus you mentality, like we're in this together. And I also think that, when you're in the moment, you're fully present, you can navigate it with them. Sometimes I do find parents, and it's understandable. A parent of an autistic child has a huge mental load. And so they're constantly having to think of like all of these things and pre-planning. But sometimes what I find is parents get so forward thinking that they're not in the moment and with the child. And that actually can be a stressor of almost anticipating too much. But when it's an us mentality, we're navigating through it together. It's not a battle. We're going through this. We're figuring it out. It's a lot easier to be present in that moment.
Yeah.
One little quick, tip of like, how do you regulate or become more present in the moment? It is a practice and it's hard. But one thing, and I have a group therapy program I do, and I literally said this to a mom. I said, I want you to think about where your feet are right now. What are your feet doing? And she was like, I never thought about where my feet were. Like, it made her stop in the moment. What it does is it like helps the brain quickly shift from like being kind of in this forward thinking to like right now. We don't think about where our feet are on a day-to-day basis. They're just there, but it helps us be present in this moment. And so if you're really struggling, then come back to, where are my feet right now? Are they touching the ground? Are they hanging off of a chair? Am I walking? And pay attention to that.
Do a body scan.
Yeah. Or a body scan yeah.
Well, wow. So I'm going to give you an almost impossible test now, Taylor, and that is to give us 2 or 3 takeaways to so many of our listeners who are parents, and especially around the PDA issues. But so many of those issues really demand that we just be good partners with children and other people. So there you go. There's the challenge.
Well, and by the way, consider yourself lucky, because our last guest that we interviewed, Barry's impossible challenge to them was bench press a Kia Sorento. So I think you're getting off a little easy here. So
I love it. So I'd say point number 1, and this does, relate, I think, to the autism parenting journey as a whole, is remember that you're the expert of your child. No professional is. And that becomes so important because, like I was talking about earlier, where it's like your kid at school looks one way, at home is different. And it's like, oh, that's a parenting problem. No, what it is you're highly connected and in tune with your kid. So be willing to advocate, even if it means disagreeing with the professionals that are around you. I think as professionals, we sometimes can have ego that comes in this, where we think we know better. But I think it's super important that we take the guide from parents. I find parents' instinct is absolutely incredible. So that would be my first point. My second point is being willing to do the work of like, okay, recognizing what are neurotypical standards and being able to sit. Sometimes it means sitting with the discomfort of what does it mean to shift away from these? And I think it is a process and a mindset shift that ultimately has to happen. And again, it's uncomfortable because it deviates from the quote unquote norm. But I think when you can learn to drop some of those expectations and really figure out what's going to serve your kid, I think that is going to be most essential. And then my third takeaway point of this is I want you to remember the child that's in front of you and meeting them where they're at, and that believing, that they're always trying their best and doing their best. And when they're having these hard moments, that just means that they need more support. And so making sure you're viewing your child as an individual, as a human first, and just focus on that connection more than anything, because that connection, I think, often is missed in a lot of autism care because we're so focused on the goals, the outcome, the progress. But what we also know is that for those goals, progress, and, shifts to happen, is someone has to feel seen and heard and validated. And so that connection becomes really important.
Mm-hmm.
Amazing.
Amen.
Did
Yes.
I stand up to the challenge?
You did.
Yes. You bench pressed the Kia Sorrento. It was perfect.
Absolutely. And you'll get a fresh cherry pie being sent to you as a gift. No,
Yeah, that's right.
That was so clear and so important. And what else could we say but thank you. Thank you for sharing your time with us and with all our listeners. And what else can we say? This was a wonderful conversation, Taylor.
Thank you so, so much for allowing me to share about this. And thank you both for, this podcast. I will say in a lot of in my diagnostic reports, it's a standard recommendation to go both read the book and listen to this podcast because I love the work that you guys are doing. And I think, we need more people like this, Dave sharing your lived experience. But Barry, I think what's so cool is seeing how you've come from academia. And academia largely has not caught up with this neurodiversity movement and, paving that path forward. And I think we need more people to be bridging this gap between the lived experience and what we know from science.
And we all know who's teaching us about the lived experience.
Exactly.
It's not us neurotypicals.
Exactly.
Thank you so much, Taylor.
Thank you.
Thank you.